My name is Dr. Matthew Bosner. I am the Chief of Cardiology and the Director of the Inpatient Hospital Services at St. Genevieve County Memorial Hospital. I wanted to speak to you today about two very important diagnoses. The first is that of a heart attack or chest pain related to decreased blood flow to the heart, and stroke, which is decreased blood flow to the brain. These are both what we call time-critical diagnosis. This is after about 4 minutes of decreased blood flow to each of these parts of the body. It occurs most commonly in older patients over the age of 60, but can also occur in younger people. There are risk factors such as high cholesterol, family history of cerebrovascular disease, but the most important risk factors are smoking, hypertension, and lack of physical activity. Symptoms related to these diagnoses, specifically with a heart attack, is chest pain, shortness of breath, sudden weakness, or pain from the chest radiating to the shoulders, arms, or back. As we get older, the symptoms not only might include chest pain, but also might include shortness of breath. We see this commonly in our female patients. Okay, it's just as common for a woman as opposed to a man to have a heart attack over the age of 60, but the symptoms seem to be more related to shortness of breath and weakness than pure chest pain. So if we have sudden episodes of chest pain, shortness of breath, weakness, pain that radiates to the arm or the back, it is important to take an aspirin immediately, call 911, and then go to the emergency department. Now we're going to speak about the details of a stroke. A stroke is decreased blood flow to the brain, which occurs over several minutes to hours. Now a stroke can present with symptoms that we use the acronym BFAST, which relates to changes in balance, eyes such as vision loss or eye movement, double vision, facial changes such as weakness in the face, arm weakness, a slurred speech, and the key thing with this is time. We have to get treatment within several minutes to less than 3 hours to preserve brain function. So if we have any of these symptoms, we need to come to the emergency department or call 911 immediately. St. Gen County Memorial Hospital has been certified by the Missouri Department of Health as a certified emergency department, meeting stringent standards for assessment and treatment of our patients for both stroke and heart attacks. So if you have symptoms, please call 911 immediately or come to emergency immediately. We have the availability, the protocols, the treatment options, and the interventions that can prevent you from having long-term complications from these potentially devastating disease processes.